There's going to be several factors that are going to influence whether a removable prosthesis is going to be ideal for a patient or not. When the prosthodontist is talking with the patient, he or she is going to be taking into consideration two main factors: extraoral and intraoral. Extraoral are going to be those things that he or she is going to be unable to control, and intraoral are going to be the key factors for the recommendation of the appliance, and that's going to be like the overall health of the tissue and also any remaining teeth if a partial is going to be constructed. So it's important for you to have an idea what each of these factors pertain and what's involved in each of them. Focusing in more detail, extraoral factors, physical health is going to be part of that. It's going to include any diseases or conditions that a patient may be experiencing. We know that certain medical conditions can greatly affect the tissue and also the bone, possibly preventing them from being able to have a removable appliance. Poor overall health is another thing. They may be unable to adapt to wearing a partial or a denture. There are certain things that can come into play. For some, you may have heard the story of a gentleman that we had that was insistent on having a denture. We try to talk him out of it, and we try to talk him into getting a partial, at least to start with, and then eventually he would probably end up in a denture. But we knew that he was a very bad gagger, and he did not want the partial, he wanted the denture, so we went ahead and did what the patient wanted. Unfortunately, when we went to put the appliance in, he was not able to tolerate it because he would gag every time the denture went in his mouth. I kind of left around that time, so I don't know whatever happened to him. I don't know if he was able to tolerate it, if he got used to it, or if he was just going without. So, and again, a condition they may be experiencing or dealing with Parkinson's disease, or they may have had a stroke where it prevents them from being able to take something out of their mouth and put something in without help or assistance. Mental health, looking at, how stable is the patient? Are they going to be able to tolerate having something put in and taken out of their mouth constantly? Are they going to be able to maintain and be able to properly keep not only the appliance clean, but also their mouth clean? So those are going to definitely be factors we're going to be looking at when we're thinking about doing a removable prosthesis for a patient. Patient motivation, how motivated are they to have this done? There are some patients who are highly motivated. They've been dealing with broken teeth in their mouth, some pain, some discomfort, they're embarrassed, and they're ready for a change to happen. So some people are very motivated and some people are not. Also needing to let our patients know that it's not going to work the same. Something removable is not going to be the same as their own natural teeth. So their ability to chew or to bite is going to definitely decrease. Age is definitely a factor. If a patient is young, then we may have to look at how we're going to design the partial to allow for growth. In the event that as time goes on, if they lose any more teeth, then we may be able to incorporate those lost teeth into their already existing partial rather than having a new partial remade every time teeth are lost. Again, with a denture, just letting the patient know that in their lifetime they may have to have several dentures made to accommodate the change of their mouth as they get older. If a person, loses weight or gains weight, that can definitely also prevent the appliance from fitting appropriately. And also, what is the patient's lifestyle? What do they do for fun? Are they involved in sports? And if so, what sports do they play? That's going to factor into the type of appliance or whether or not a removable is going to be ideal for them or not. Obviously, if they're a hockey player, we're probably not going to encourage them to do anything fixed. Anything removable would be ideal. They would be able to take it out before a game and not have to worry about breaking any more teeth. or damaging their partial or their denture. We had a gentleman who played the trumpet and was thinking about getting a denture. And after looking at his mouth and the x-rays, we were fortunately able to save some of his teeth and give him a partial, which he was still able to play the trumpet very well. Had we given him a denture, he may not have been able to continue doing what he loved and playing his instrument. Also, patient may view themselves as old because they associate having a denture or a partial with a person who's old. That's not always the case. There's, things happen in life, and being in a denture or partial at a young age is obviously not ideal, but things happen, and it's better that you're thinking about your overall health in that regard, and trying to get a replacement of any kind is going to be better than nothing. Dietary habits, very important to look at those. How healthy is the tissue? Again, how healthy are their remaining teeth? If a person is getting a partial, we need to make sure that they're maintaining their oral health, but also what they're putting into their bodies. So we may have to educate our patients and encourage them to maybe choose a little bit more healthier lifestyle than what they're accustomed to, and making some changes to their diet, just to allow for the ability for them to, have a good result when it comes to their appliance and being able to wear it comfortably. Social and economic factors. Believe it or not, there are a lot of patients that are perfectly fine with going without teeth. It doesn't bother them. They've gotten used to it. So trying to convince them to get some sort of a removable appliance is probably not going to happen. We do, again, want to encourage them and educate them on how or why a removable prosthesis would be ideal, just because it allows them to chew their food properly, allows them to then, digest their food, and not have any issues when it comes to digestion or anything like that. A patient's attitude about their oral health, is also going to be a determining factor when it comes to an appliance. Some people just don't care and they're fine with how they look, and that's going to be okay. Major thing is going to be the ability to pay for them. Anytime you're removing teeth or getting an appliance, it is very costly, so that oftentimes factors into whether or not that's something a patient can do right away, or they may have to wait a little bit until they're able to come up with the money. There are programs out there that can help provide some assistance with patients. There's Care Credit that's out there that acts like a credit card. They can even get interest for a year, if not longer. So they're able to kind of pay monthly on it rather than having to come up with all of it at one time. We've had people that have, money was raised in their church and they were able to get their teeth fixed and replaced in that manner. Some people have started a GoFundMe account, and there's also programs for low-income individuals as well. Occupation is going to play a part. Obviously, if the person is dealing a lot with the public, then they're probably going to be more motivated to replace any missing teeth that they have, and just to try to get their smile back as best they can. So that's definitely going to be motivating to them. But another thing to think about with that is if we're going to be doing a denture on a patient, oftentimes we encourage them to try to go without teeth for a couple of months, 2 to 3, if not 4 months, to allow for healing before a denture is then actually made, just because it's going to fit much better. But oftentimes, people, if they have an occupation where they're, having to talk with people or interact with people on a daily basis, that may not be an option for them. And of course, we want that to be the prosthesis to look as natural as possible, so that people don't really know that the patient is wearing a denture or a partial. Intraoral factors, musculature, facial muscles are going to contribute to it, how well they're going to be able to function with a partial or a denture. Like mentioned before, the muscles of the cheeks and also the tongue are going to have to learn to sort of work to keep the appliance in sometimes. So if they do have a medical condition that maybe they have issues with some of their facial muscles, then that could prevent them from being a candidate for a removable partial or denture. And then any unusual facial habits that the patient may have can also impact whether or not they can accommodate a removable prosthesis. Salivary flow, we know that anything you put in the mouth tends to stimulate the flow of saliva. Putting a denture or a partial in is no different. We, tell patients to, that is a side effect of having something in their mouth constantly that the body's not used to. So to expect that. And oftentimes patients will say that, they feel like they're, spitting more when they're talking just because that saliva flow is kind of excessive. Once the patient kind of gets used to it and the body gets used to it, the salivary flow goes back to what it was before. If a patient has had a stroke, then that will prevent them from oftentimes that saliva flow returning to normal just because of their condition. And, if there is a lack of saliva, can cause a xerostomia. And a lot of medical conditions, medications can impact that. And oftentimes patients have complained of the appliance sticking to their lips and their cheeks just because they don't have enough saliva in their mouth. So again, all these are factors that affect an individual being able to accommodate a removable appliance. Residual alveolar ridge, very, very important. That alveolar ridge is the one that supports the denture or the partial. So we have to make sure that it's contoured correctly. That's why oftentimes if we know we're going to be doing some sort of a removable appliance, once the teeth are extracted, some alveoloplasty or alveolectomy might be done to contour and reshape that bone to allow for something to fit on top of it. So when they do start to chew, it's going to be able to support the stress of that. And of course, if it's uneven, that's something they'll always check. If it's rocking in the patient's mouth, then that can often lead to some friction and irritation, causing some sore spots. And then if there isn't enough ridge, then need to look at possibly doing some bone grafting, maybe an alveoloplasty might need to be performed just to ensure that they have enough ridge there to be able to accommodate something sitting on top of it. Oral mucosa, again, it can be altered by patient's physical condition. If the, just constant wear and tear, that irritation can cause pressure points or sore spots in the patient's mouth that they'll need to come back in, and we can try to get that taken care of by making some adjustments to the appliance to make it a little bit more comfortable. Once the appliance is delivered, whether it's a partial or a denture, we would always bring our patients in a couple days after and check everything to make sure everything was okay and make any adjustments to the sore spots that they were experiencing. Oral habits, of course, if a patient clenches or grinds, if they have a lot of stress in their life, then that can wreak havoc on not only the remaining teeth, but also the ridge itself. Just that constant friction can cause recession, so we definitely want to look at that. If they're a mouth breather, they can have adverse effects. Number one is xerostomia, can lead to just having a very dry mouth. Tori, we know, especially if it's severe enough, will more than likely have to be removed and be able to accommodate for a denture or partial to fit on top of it. So there's going to be different types of tori. Tori can be on the mandibular arch. It can be on the maxillary. It can also be on the palate. This just kind of gives you an idea of what the tori kind of look like once it's been exposed for removal surgery, and when it would need to be removed. Obviously, this patient here, there's no way that a partial or denture can fit with that there, so that would definitely need to be removed. Palatal tori, same thing with here. The way this bone here is very bulbous back in this posterior region is going to prevent this patient from getting an accurate seal when they put the denture in. So this would definitely have to be reshaped and recontoured, and definitely this right here would have to be removed to be able to accommodate some sort of a removable appliance to be able to sit comfortably in that area. So these are all both extraoral and intraoral factors that must be taken into consideration.